Today we'll be talking about lower anterior teeth for porcelain veneers. We begin with a waxed up model, and this is used for provisional restoration fabrication. The patient was dissatisfied with her upper and lower anterior teeth. She's a TV personality, and her appearance is very important to her. She didn't like the color of the teeth, the shape of the teeth, and you can see the teeth are worn. So after much discussion, we decided to place porcelain veneer restorations. This is just a very conservative all porcelain crown or EMAX preparation. So occlusal reduction of 1.5 millimeters, and then facial, lingual, and interproximal reduction of approximately 1 millimeter. And I'm using a round-ended coarse diamond as well as a fine flame-shaped diamond and a medium chamfer diamond for the preparations. You'd like the porcelain veneers to extend approximately 1.5 millimeters incisally. So check the occlusion first and see if there's anterior coupling. Or if you want to increase the length of the teeth. If you do want to increase the length of the teeth, there may be no reason to do anything other than just polish the incisal edges. In this case, there was anterior coupling, so we're going to reduce the incisal edge approximately 1.5 millimeters to make room for porcelain. Now, when you're reducing the incisal edge for veneers, it's very important that you have a right angle margin on the incisal lingual line angle. You don't want a taco margin. You want the incisal reduction or preparation to be perfectly flat. This gives you the greatest strength with the porcelain veneers. Monnier and Douglas did a series of studies on veneer tooth preparation, and these studies showed that if you include the incisal edge and you include the interproximal surfaces of the teeth, you end up with the strongest, most stable restoration. So I've made my depth cuts of 1.5 millimeters, and now I'm finishing the incisal preparation with an occlusal reduction diamond. I'm cutting all the way through the interproximal areas with a small flame-shaped diamond. Remember, we want to include the interproximal surfaces and the incisal surface. Now this is a mosquito diamond just to finish the interproximal preparation. Now I'm rounding the facial interproximal line angles with that mosquito diamond and the small flame-shaped diamond. I'm next coming back with a small, coarse barrel diamond for the facial reduction. If the teeth are in the correct alignment, then you want to reduce the facial approximately 0.5 millimeter. The enamel gets thinner at the gingival third. So I try to reduce that tooth structure no more than about 0.3 of a millimeter. Even if I have to come back and polish my final veneer margin just a bit. But in the body of the tooth, the enamel is thicker, and so we can reduce that a full 0.5 millimeter. And I do that with the round-ended coarse diamond burr. Now I'm placing my margins with that small flame-shaped fine diamond. Then we're going to round the incisal facial line angle. And all line angles, you don't want any sharp line angles in any preparation. Every line angle should be rounded. This prevents porcelain fracture and opaque shine through. I'm going to check the incisal reduction, and again I want approximately 1.5 millimeters of space for the porcelain cantilevered off the incisal edge of the prep teeth. Very important to round the incisal facial line angles. Now we're fabricating provisionals for the bicuspid crowns and the anterior porcelain veneers. Adjusting the provisionals, cord placement around the bicuspid crowns only. So the only place I don't place cord prior to impression taking is the lower anterior teeth, just because that tissue is so friable that more times than not the tissue tears when you're placing cord in the sulcus. Then our impression technique with the polyether impression with custom tray. Face bone mounting is very important. Polybonus siloxane, blue mousse, occlusal registration record, checking the provisional occlusion, and I'm seating the provisionals with temporary cement in the bicuspids and unfilled resin or adhesive only without primer for the porcelain veneer provisionals. Once you seat those, cure each provisional for 20 seconds. Once the provisional cement and the filled resin is set, check the occlusion, take final photographs, and you're finished.
Thank you all so much for joining us this week on the Dental Minute. Make sure you subscribe, and we'll see you next week where we'll be talking about placing upper mini implants to secure dentures.